With the rising number of coronavirus cases in Africa, the lives of doctors and other healthcare workers remains on the line. Well, we delve into a day in the life of one of them in Cameroon.
With the help of a nurse, Dominique Jomo puts on his personal protective equipment: a cap, coveralls, protective glasses, visor, gloves, and starts another day fighting a torrent of COVID-19 cases. The anesthesiologist's work at Douala's Gynecology, Obstetrics and Pediatric Hospital has changed beyond recognition since the first case of the new coronavirus was detected in Cameroon in early March. The Central African country now has one of the highest cases in the region, with over 2,000 people infected and over 60 people dead. While scenes of overwhelmed hospital wards have been broadcast from across Europe and the United States, most African countries have so far been spared much of the mayhem. But health facilities in sub-Saharan Africa are even less prepared for a pandemic, and the treatment of serious coronavirus infections requiring ventilators and long stays in hospital. They lack equipment, trained staff, and beds. Jomo used to spend his days between the operating and emergency rooms and doing consultations. Now, the new coronavirus and the people dictate his time. Jomo and his team frequently work 24-hour shifts. But he says he will never turn away a patient, no matter the level of risk. Instead, he's determined to make everyone in his hospital safe by taking maximum precaution.
I
want to personally play my part so that at the end of this epidemic, I can be satisfied with what I've done, to have the feeling that I gave all of myself and that I did not do less than I could. The professional challenge is being able to accompany all those people, to cure the maximum number, and to have zero contamination among the personnel, among all those who gave day and night in the care of the patients from this very start of the pandemic we have here at home.
Yet sometimes the hospital does have to turn away patients. Jomo's ward has 5 ventilators and treats critical patients with respiratory problems from the coronavirus infection. His family and friends worry that he may get infected. They've heard news that protective equipment in most parts of the world is running short for medical staff.
At home, they understand what I do, and they always tell me every time, every morning and in the evening, to be careful, be careful, be careful. My friends and family tell me to take care, but we remind them that it can happen to anyone. Anyone can fall ill. I can come to the hospital and see a friend come in. I will not turn my back on him. I will take care of him. For every job, there's a risk, and we'll do it. We'll take precautions, that's all.